What is a subluxation? Well, don't be concerned about the technical term subluxation. It just means that there's a misalignment of one or both of these top two bones in the top of your spine, the atlas or the axis. So you don't have to be concerned about the term. What you do need to be concerned about is if you have a subluxation and the negative impact that it's having on your body.
1/3 of the nerves up here produce pain when they're pinched. 2/3 of them don't. So you see, 2/3 of the people are walking around like this saying, I don't need a chiropractor, I feel fine, okay? And they feel fine because the body has produced certain chemicals to deaden the nerves. Otherwise, we would all have just unrelenting pain. And so these hidden subluxations, sadly enough, are as common as cavities.
Picture if you have an electrical panel in your garage that runs electricity to your entire house. If the switches down below you flip those breaker switches, they run power to the regions of the house, but that main power switch turns on power to the entire thing. So if you don't get these two bones back in alignment in this upper cervical spine, it's like that main power switch. You're not getting that information to that entire house. Your body can't function or heal properly.
The challenge that you have with vertebral subluxations is the fact that the vertebra is just not moving and is crushing and compressing the nerves. And the end result is that the person can start spiraling downhill, especially if they're using a lot of pharmacological agents, because there isn't a drug in the world that's going to move the atlas back into position.
And so that's one of the unique dynamics of upper cervical care. An upper cervical care doctor is not chasing after pain or symptoms. They're going right for the cause of that disease or ailment, which is the subluxation. And we're talking about precise corrections here, sometimes millimeters, sometimes even a fraction of a millimeter.
That particular 1 millimeter at the atlas, that particular 1 millimeter could cause you to have asthma. It could cause you to have reflux. It could cause your heart to not work properly. That 1 millimeter affects your nervous system. And because the nervous system controls everything, that's why that has such a powerful impact.
When your top vertebra dislodges, the rest of the bones all the way down the spine go out of alignment. It's called spinal compensation. When you put the top one back in, through muscle memory, the muscles literally pull the rest of the vertebra in. It's called spinal decompensation. And as those changes take place, the neurological pathways come back to life and the body virtually mends itself. And this is why we chiropractors say that we don't cure anything. It's the body that does the curing.
So that's what I say. I'm a facilitator. I remove the interference and I just watch the miracles that happen in your body.